Medhat Abbas, who is the Health Ministry spokesperson of the Palestinian government, is joining us over the phone line right now. Thank you so much for speaking with India Today. First of all, the update on the numbers that you have on the fatalities as far as Gaza is concerned.
Well, about 7,000 injured and 1,200 killed till now among the Palestinian citizens.
Right. And so can you tell us about the sort of injured persons who are reaching the various hospitals? We've heard various sorts of reports about where white phosphorus being used, that is being alleged by the Palestinian Authority. What sort of injuries are people coming with? How many among them are women, children?
30% of them are children, and can say 10% are women. The problem is that when they come, they are burned, they are disfigured, they are amputated, they are decapitated, they are having massive injuries. So because it's F-16 shelling domestic zones, attacking the houses while people are inside, so they are totally disfigured. They are not shot by bullets, they are shot by F-16 missiles. The other point is that regarding the health situation, prior to this crisis, we have had shortage of medications, medical supply, and reagents required to operate the laboratories. So after this escalation, what happened is that we are consuming now in one day what we usually used to use in 1 month before this crisis. There is no safe route in Gaza Strip. There is no safe area in Gaza Strip now. Every area is expected to be shelled at any point of time. Nobody knows. Usually they used to threat people to evacuate before attacking the building, but for many times now, they are not doing that. They are attacking houses without threatening people while people are inside. The other thing is that there is a decision to cut electricity and to cut water and to cut food. The borders are sealed, so we have no access to any humanitarian support to the population now. So now in our hospitals we have no electricity, and that's why I can declare it clearly that there is a collapse in the health system because of shortage of medications, medical supply, laboratory requirements, and fuel required to operate generators, and we have no electricity. In the hospitals, we used to have standby generators. They operate when there is no electricity. The problem is that the fuel was very limited amount. That's why now we have no fuel in the hospitals and we have no electricity. Let me talk about the number of casualties. In fact, of casualties, many of them are lying on the ground now in the emergency rooms, and doctors are helpless because of the large number attending to the hospitals along the hour and the very limited resources. So the only solution now, and of course, more than 300,000 people now have left their houses and displaced to some schools considered as shelters now. The Israelis are attacking the ambulances. More than 20 ambulances were attacked. Many health facilities, hospitals were directly attacked. A full hospital was totally closed because of the bombardment in Beit Hanun city. One of the ambulances was hit inside the premises of Khan Yunis Hospital in the southern provinces of the Gaza Strip, and the Indonesian hospital also was directly attacked. Many of the health professionals are already killed during these crises. The situation is very miserable, and without having a safe and a corridor, humanitarian corridor for the Palestinians to send injured outside to be treated like in Egypt or Jordan. The other thing is that there should be directly opening of the borders so that we can have fuel and we have electricity and we have food and we have medications to the community. Otherwise, we will certainly, within the coming few days, we will witness a collapse not only in the health system but the entire community.